As of May 2025, House Bill 1031 has passed the Indiana House with bipartisan support and is under consideration in the Indiana Senate. House Bill 1031 is an interstate agreement that aims to enhance the mobility of licensed dental professionals across member states, thereby improving access to dental care in Indiana, particularly in underserved rural communities. The provisions in House Bill 1031 are, again, the interstate practice privileges of dentists and dental hygienists licensed in one compact member state would be permitted to practice in other member states without obtaining additional licenses, provided they meet the compact's eligibility criteria. Support for military families is also included in this House bill. The bill includes provisions to reduce or waive licensing fees for active duty military personnel and their spouses, facilitating their ability to practice in the state of Indiana. Regulatory oversight. A governing commission would be established to oversee the compact's implementation, ensuring compliance and facilitating information sharing among member states regarding licensure and disciplinary actions. And lastly, enhance enforcement measures. The legislation expands the authority to file injunctions against individuals practicing dentistry without a license. That's actually an important one because there's been a rise of something called veneer techs, where people are going out and doing a weekend-long course and then marketing their skills for affordable veneers. And again, these are composite veneers, not a veneer that is going to be made out of a different material. Again, remember, composite stains, and there are a lot of drawbacks, and how they're able to be more affordable is partly because the material they're choosing. But I do like that they're stepping up enforcement actions, because in certain communities, veneer techs are a real problem. And same with regulatory oversight. This is going to be crucial as well, because what you don't want to have happen is a dentist get in trouble in one state and just move to a different state and fall through the system because the compact member state agreements have a breakdown in communication. So that's going to be an important one from an implementation standpoint to make sure they get that right. And then lastly, for the state, the projected fiscal implications of this bill. The Indiana Professional Licensing Agency anticipates initial implementation costs ranging from $170,000 to almost $42,000, primarily for the IT systems updates to integrate with the compact's data system. Again, that's going to be really important to make sure that dentists that get in trouble don't just move states and again fall through said cracks. So comment down below. Very curious to see how the Senate is going to vote on this bill, but I do like the premise where it's coming from, where it's allowing, in particular, hopefully a increase of rural dentists here in the state of Indiana. That is a problem. And as we move forward with potential Medicaid cuts and things of that nature, there's a lot of noise and a lot of things to digest. So comment down below and we will keep you guys updated. Cheers.